Solution-focused brief therapy is a counseling approach that focuses on finding solutions rather than spending a lot of time discussing problems. The goal is to help clients recognize their strengths and use those strengths to make positive changes in their lives. SFBT is based on the belief that people already have resources and abilities that can help them overcome challenges. SFBT focuses on what is working rather than what is wrong. Therapists help clients set goals and identify steps they can take to improve their situation. The approach encourages clients to focus on the future and recognize that even small changes can lead to larger improvements over time. In SFBT, the therapist works collaboratively with the client. Instead of telling clients what to do, the therapist asks questions that help them recognize their strengths and discover their own solutions. The therapist's role is to encourage hope and help the clients build confidence in their ability to reach their goals. SFBT uses several techniques that help clients focus on solutions. These questions encourage clients to think about positive changes, recognize progress, and identify times when they successfully handle challenges. These strategies help clients build confidence and move towards their goals. The miracle question is a common SFBT technique that helps clients imagine what their lives would look like if their problem was solved. This encourages them to think about goals and identify specific changes they would like to see in their lives. Many adolescents respond well to SFBT because it focuses on their strengths instead of their problems. This approach allows young people to participate in setting goals and finding solutions. This can increase motivation, confidence, and engagement in counseling. Youth in foster care often face many challenges. They may have experienced abuse, neglect, family separation, or multiple placements. These experiences can lead to emotional difficulties, problems in school, and challenges with trust and relationships. Because of these experiences, foster youth often benefit from the approaches that focus on strengths and resilience. SFBT helps foster youth recognize their strengths and past successes. Instead of focusing only on difficult experiences, the therapist helps youth identify what is working and how they can build on those successes. This can increase hope and help youth feel more capable of handling future challenges. For example, a 15-year-old foster youth may struggle with school attendance and anger. Instead of focusing only on these problems, the therapist might ask about days when the student attended school or handled frustration successfully. The therapist and youth can then use those successes as a foundation for setting of future goals and creating positive change. SFBT can also be used in group counseling. Group members are encouraged to share strengths, successes, and strategies that have helped them overcome challenges. Hearing positive experiences from peers can increase motivation and help members develop hope. Group leaders focus discussions on solutions and future goals rather than spending extensive time discussing problems. Research supports the effectiveness of solution-focused brief therapy across different populations and settings. An umbrella review discussed by the Solution Focused Universe found that SFBT helps improve mental health, supports goals achievement, and builds hope. The research also suggests that SFBT can produce positive results in a relatively short amount of time compared to some other treatment approaches. In conclusion, solution-focused brief therapy is a practical and strength-based counseling approach that helps clients focus on solutions instead of problems. It can be especially beneficial for adolescents in foster care because it promotes hope, resilience, confidence, and goal achievement. Research continues to support SFBT as an effective intervention in both individual and group counseling settings.